Hi, this is Dr. Liz Cruz, gastroenterologist in Phoenix, Arizona. Thank you so much for watching this. I thought I'd share something exciting with you, something that I got in the mail, and I love packages and I love surprises. At first, I didn't know what this was, and I still haven't opened it because I wanted actually to open it up with you. And I kind of know what it is. I had an idea only because a couple weeks before I got this package, I got a letter in the mail. And I would imagine that this is the same type of letter that a lot of my patients tell me that they received. And I'm like, oh my goodness, am I that age now where I'm getting these letters? It just said that a Cologuard kit would be sent to my home, that it was time to do it, and it talks a little bit about Cologuard, that it's an easy to use screening test for adults 45 and older who are average risk. Average risk, meaning they don't have any risk factors for colon cancer, such as, because you should not use the Cologuard on these patients, okay? And these are the risk factors. If you've already had a colonoscopy and you've had precancerous polyps found, adenomas, then you should not be doing this. If you have inflammatory bowel disease like Crohn's or ulcerative colitis, you should not be doing this. If you have certain hereditary syndromes, or if you have a personal or a family history of colon cancer, you should not be doing this. All right, you should have a colonoscopy done. And anyways, I got this letter and I was like, oh my goodness, this is the same letter. I'm pretty sure that I have had multiple patients through the years tell me that they have received. So I am assuming that this is a Cologuard. I'm going to be really surprised if it's something different. But my wife says she didn't send me any packages recently. All right, I like what they put on here. Why did I get this box? Okay, I haven't peeled this. This package has not been touched. I'm going to peel this. And basically it just says on the back, it's time to screen for colon cancer. Your insurance company has partnered with Exact Sciences to send members screening tests that they can use at home. The Cologuard test is a member benefit of the insurance plan. So apparently the insurance that I have, this is one of the benefits. There is zero cost to me, zero cost. And then it has a QR code so that you could learn more about the Cologuard test. All right. All right, let's get started. I love opening up packages. Let's make sure I'm not missing anything else. No. All right, I'm gonna tear this little thing up. Excited. All right. It is a Cologuard. On top of here, it says the Cologuard Collection Kit. All right. And again, it has a QR code for more help. And then it tells me what's in the kit. All right. So let's open it up. Oh boy, this is going to be fun. There's a big pamphlet brochure on how to do the Cologuard. I guess, and this is in Spanish and this is in English. And basically, I guess it's going to go through everything in detail, how we collect it. So what is a Cologuard? Well, let me pull out this stuff and then I'm going to go into that really quick with you, because that's really the point of me recording this. All right, so we've got a nice bag here. Oh, this bag doesn't come out of here. This bag is like stuck. Okay, wow. Since I've never opened a Cologuard package, I didn't know, but now we're learning. It looks like what we've got here are, we're going to have instructions, labels, bracket, container, and we're going to have a stabilizing agent and preservative. Okay, so I'm just going to pull out this stuff here. All right, it looks like this is our container. We're going to collect stool. That's what you collect. And I'm not going to open this because I don't know if maybe this isn't supposed to be open until the stool is collected. So, but I'm going to show you. You have the container here. And then you've got what they call the preservative to preserve the stool sample. And And then it looks like you've got a little, what is this? Oh, this is the stabilizers. This is gotta be the stabilizer that they talked about. And a little paper towel. I'm gonna put this back in here. And then also there was a whole thing with they talk about the labels. So I'm gonna assume that this is the label portion. Yeah. This is the label portion to give you an example, fill it out, John Doe, your date of birth, the data collection, and the time. So these are the labels, and you're going to put one on the tube and then on the stool. All right, put one on the stool. That's the kit. And then they've got all these instructions here. You're going to empty, I guess there's like a little, the little bladder here. Oh, there you go. I guess this is the thing that we're going to put out. This is what we're going to put on the toilet. Okay, so basically, we're going to be collecting stool, and they've got everything. They've got this to put on your toilet bowl. So it's got everything in it. It's like the whole package. And what is Cologuard then? Basically, Cologuard is a stool test that is looking for abnormal DNA and also for blood. And so where does the DNA come from? They're looking for DNA cells that have shedded off of cancers and polyps. All right. And presumably it would be an abnormal polyp, like a precancerous polyp. Those abnormal cells get shed. Okay, they get shed from the tumor, if there's a tumor in your colon, or even from these precancerous polyps. And also, a lot of times if you have a tumor will slowly release blood. And so that's why this test is also looking for blood. And if you have any positive Cologuard, okay, whether it's due to an abnormal, whether it's due to DNA that's been shed from a tumor or precancerous polyp or blood, the Cologuard will be positive. And then what follows after the Cologuard then, especially a positive Cologuard, then would be a colonoscopy. It's a test that has been out actually for a long time. This is great, okay? And my point today is going to be just more educational. I don't want anyone to think in any way that I'm bashing this test, but I will say that I am not a fan of Cologuard. I'm not really even a fan of the stool tests that are out there. There's a lot of stool tests out there that will test for blood. There's more stool studies that are coming out that'll be available that are to test for abnormalities in the stool, basically that would indicate, that will detect that there could be a problem like a cancer or precancerous polyps. The problem is that if you have any of these tests coming back positive, the concern is that you already have something that's developed, okay? And the whole point of getting a screening colonoscopy is to prevent you from getting to that point, okay? And sure, when we do colonoscopies, we find polyps, and while we're there, we take them off. And also we find cancer, and it always makes me sad when I find a cancer on someone when I'm doing a colonoscopy on them, because that should never have happened. Never. Because we've had screening colonoscopy as a test that's been available for over 20 years. In fact, when I started my fellowship back in 2000, I started my fellowship. It was in 2000 when the recommendations came out that a colonoscopy was now the gold standard for colon cancer screening, all right, for prevention, all right? Our goal is to prevent something as opposed to detecting something where now, it's so advanced that possibly it might be too late, okay? We don't want to get to that point. And so the reason that I'm not a big fan, and it's not that I'm against Cologuard, I do believe that there is a place for it, but in my opinion, the Cologuard is not for a 45 or a 50-year-old or a 55 or even a 60 or 65-year-old person who has never had a screening colonoscopy. What that person should be having is a screening colonoscopy, because what we want to do is prevent. We want to prevent them from getting colon cancer. And so I will use Cologuard, and I have ordered Cologuard, but I'm telling you, in my career of doing this, and I've been practicing gastroenterology for over 20 years, and Cologuard, I don't know how long it's been out. It's been out for several years. I can probably count on one hand how many times I've recommended a Cologuard. And because I am a huge, huge proponent that colonoscopy is the screening, it's the golden test, it's the gold standard for colon cancer prevention. So if you have not had a colonoscopy, please get your colonoscopy. Please get it done. If you are 45 years old and let's say that you have no family history, so you don't have any risk factors, please get your colonoscopy done. If you have any family history, if you have risk factors, for sure get your colonoscopy done. If you've had a history of colon polyps, of adenomas, please get your colonoscopy done. Don't do a Cologuard. Don't do any of these other stool tests. Get a colonoscopy. You're going to be hearing me talk a lot about this because I really think that it's so important. And I'm very passionate about making sure that my patients get their colonoscopies. And so I'm making it my mission to make sure that we get the message out. All right. Thank you so much for joining us. Please connect with us. Go to my website, drlizcruz.com, and connect with us. We'd love to hear from you. Take care.